So we didn't mean to say that we weren't fast. But different kinds of flu. They came on the test and it was negative for all of them.
Oh, good. That's good. Yeah.
I mentioned to Jim about
Jeez, like really.
I didn't know they could test.
No?
We'll begin this morning with a pledge of allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning and welcome to the October 25th meeting for the Shawnee County Board of Commissioners. My name is Kevin Cook. I serve as the chair, and joining me today is Commissioner Bob Archer. Good morning.
Good morning.
Commissioner Bueller had let us know on Monday that she was not going to be able to attend this morning, so it's just the two of us holding down the fort. With that confidence,
We got you covered. It's
all
okay.
right. Our first item.
Item 1 under proclamations, presentations, third quarterly report on Grace Med. Alice Weingartner, Director of Community Development.
Good morning, Commissioners. Alice Weingartner, Grace Med Health Clinic. It's a pleasure to see you.
Good morning.
Also happy that fall has finally arrived.
Yeah.
So the third quarter for us has been a really exciting third quarter. We did open our new clinic at the Huntoon and Lane building on August 13th. We have seen a number of individuals new come through the facility, mainly just to see where they used to buy their bread and where they used to get their milk. So that's been fun, but it's just great to see folks come in and see the facility for the first time. We are now in a 23,000 square foot facility. We have enough space for 8 full-time medical providers, 4 full-time dentists. We eventually will be adding an eye doctor and a pharmacy as well. Those are 2 things, though. We really have to make sure we have the capacity of patient need before we can add those services to the clinic. On October 12th, we also learned that we were going to be the recipients of the Maybe Foundation Challenge Grant, which meant we received $500,000 from them, which helped us meet our goal for Project Wellspring. So we're really excited about that. I can't say enough about the support of the community. You as commissioners, were some of the early funders of this project and helping support this project and this clinic in our community, which was so desperately needed. As of October 8th, I'm happy to report that we do have 3 full-time dentists on staff. Each of them busy, providing that new service in our community, and we're very excited to have them. We certainly encourage people to continue to call and make appointments, get those appointments to establish care. If you need a doctor, we can be your doctor. If you just need a dentist, we can be your dentist. So again, we're open to anyone. We can serve anyone, whether you have private insurance, which we accept all of them, or if you have no insurance, which we offer a sliding fee scale. By the end of October, we anticipate that we will have a total of 56 employees, and that's an increase of 20 employees since July of 2016. So you can see that there's been, with the addition of dental services, with the reintroduction of behavioral health, there's definitely been an increase in the number of staff that we have. We also have a new physician that joined us on October 22nd, and that is in addition to a women's health nurse practitioner who joined us a couple of months ago as well. So we have women's health services at both of our clinic locations currently. One of the other big changes that's taken place this year is with Topeka Public Schools and our oral health outreach program. We are piloting a project where we have been going into the schools for the last year and providing preventive services for the students. This year we're following that up with a dentist who then goes back in a few weeks later and can do some of that restorative care, such as fillings, if there's baby teeth extractions that need to happen. And so again, trying to decrease that barrier and improve access for those students. For our third quarter report, I did a comparison of our 2017 third quarter to our 2018 third quarter, and we show an increase of 351 unduplicated patients and an increase of 1,808 encounters or visits. So, you know, some of that is due in part to the reintegration of behavioral health, but also the addition of dental, and I believe we'll continue to see those numbers go up as well. I open up, you know, to the community, to my former partners here at the county. If you haven't come in to see our new clinic, please call. Would love to show you around. It really is a jewel in the heart of Topeka, and we're really happy to be there. So I'm happy to answer any questions.
I think this is great news for the community, and not just great news for Grace Med, but Grace Med, great news for the entire county. Expansion of services, expansion of offerings, expansion of clientele base. This is just tremendous. Commissioner Archer.
Yeah, I agree with you, Commissioner. You're doing so much for so many. I think it's just gratifying for our community.
Yeah. I'll tell you one of the things, you know, you use the word gratifying, and that's truly what it is. And running into people in the community and people in our clinic who are coming in and who are so emotional about the ability to get needs met that they haven't been able to have met before. It's just been very rewarding. So we really enjoy that part of our job.
Keep it up.
So, thank you.
Thank you.
Thanks.
Our second item.
Item 2 under proclamations presentations, presentation regarding Old World Blue Stem invasion grass. Michael Bassett, Chairman, Conservation District.
Thank you. Excuse me. Thank you for having me, and thank you for your time, especially after a presentation of how someone's solving a problem. I'm afraid I'm dealing a different problem on your lap. Old World Blue Stem. Is there a PowerPoint that we can put up? Do I click or? Old World Blue Stem is a grass that I just started hearing about. That one? Thank you. Just right-clicking on it? Very good. And how do I advance it? Thank you. So this is north of I-70 and east of the Auburn Road exit. And that, besides the great big junipers. Thank you. All that straw-colored grass with nothing else but junipers pretty much in it, that's Old World Blue Stem. And once you learn to look for it, you can see it coming up and down the sides of the interstate and sides of many of the roads leading into Shawnee County. Now, I'm just a guy trying to learn how to take care of the family ranch. I don't have any special expertise, but the people I listen to at K-State say this can take over the Flint Hills and our native prairie grass in 25 years if we don't do something. And right now, the primary vector for it being spread is the mowing of our roadsides after this stuff has gone to seed, and the mowers taking it up and down our county roads. And you can go to places around my ranch. We're on the edge of Wabaunsee County where it's coming from, and our land is on both sides of the county, so it's within feet of my ranch in Wabaunsee County, and it's still a quarter mile away to a mile away in Shawnee County. And there's if we know if we don't take care of an invasive problem with an ounce of prevention, the pound of cure gets really, really painful. When I used to cross Mission Creek with my grandpa and learned how to feed cattle and work on the fence, I didn't know what Sericea lespedeza was. My dad didn't know what Sericea lespedeza was, and when I finally learned, I wish we'd known a lot earlier. So education, publicity, and then learning what we can do to stop mowing at the times we're mowing, or do something proactively if they can't change the mowing times to go out there and knock it down while it's still a small problem. The worst thing about this is there's no selective chemical we can use to knock it out. when we're spraying Sericea lespedesia, as an example, we can go and spray the Sericea lespedesia and the grass is pretty much fine where we spray it. Here we have to Roundup it. So if you get a big patch of it, you're talking about rounding up your whole ground or plowing it up and planting something that's glyphosate ready. So we don't have an easy solution if we don't do some prevention. I could show you more pictures of it, but I don't want to take up a lot of your valuable time. I know any problem needs leadership, needs community action, and needs education facts about what they can do. And anything you are willing to do to help us educate the people who mow the roads would be very, very helpful. Thank you.
Well, before you go, you're here as part of the Conservation District. Why don't you tell us a little bit about what the Conservation District does and how they interact with K-State Extension and interact with the Public Works Department, because I know that we all are interdependent and we do coordinate with each other. So tell us a little bit about that. What is the Conservation District?
The Conservation District, the short history is we stretched clear back to soil conservation days, and it was a program to have community elected leadership that could educate and be informed and provide a community voice as they try to stop another Dust Bowl from happening. And whether it's the soil running into the our drinking water and filling up our reservoirs, or whether it's stopping other forms of erosion, or if it's stopping invasive weeds that can threaten our livelihood. The Conservation District is the first line of community education to tell people about what's going on and what programs are out there to help them. So we depend entirely in this county upon an excellent weed control department, and you know, they're out there teaching us and working with us and working with the ranchers and the farmers and the other interested community members to go out and, you know, identify what the problems are, pick a solution appropriate to the person's operation and land, and then help them monitor how well it's working when they execute it. Shawnee, the Extension, and K-State are the places we look to for expertise. And again, education, providing forums. We have our, you know, cookie and coffee forums where we bring people in to talk about issues like this.
Well, and I appreciate you coming from the Conservation District to talk to the County Commission about the mowing, and I'm looking to Tom Flanagan, and that's something that we, Public Works, would maybe look at taking up. I know that when we don't mow, we often get calls from the landowners concerned about the unsightly appearance, how it looks, sight visions, being able to see, and we constantly will get calls about unsightly appearance when it's not mowed. But being able to coordinate with the Conservation District, the Weed Department, the K-State Extension, to be able to explain if we aren't mowing, why we're not mowing, and how that can have an economic impact on the community. And so I think that, you know, keep your efforts going and make sure that you're educating the individuals and landowners about how this will impact them in the future.
Very good. Thank you so much for your time.
No. All right.
Thank you.
Yes.
Can I ask
Absolutely.
Good morning, Cindy Evans with K-State Research and Extension in Shawnee County. Just as part of what they were sharing today, there is a program scheduled for Wednesday, November 28th to address this issue. And I believe that the Weed Director, John Wellborn, will be the presenter in Conservation District, and our office, Shawnee County Extension, with a couple other partners, are going to be doing an educational program related to this. So I'm sure that Leroy, if I'd have looked at the agenda ahead of time, I would have had Leroy come down today, but we'd be glad to add any other, or answer any of the questions you might have related to that.
November 28th, where?
At the Extension office.
All right, great. And
Thank
that's,
you.
At the Expo Center.
Yes.
All right.
Thank
Great.
you.
Thank you. Our next item.
Item 3, consent agenda.
There are 5 items on the consent agenda. Are there any questions?
Move to approve the consent agenda as presented.
I will second. So motion made by Commissioner Archer for the consent agenda, seconded by Commissioner Cook. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item 4, new business, A, County Clerk, number 1, consider all voucher payments.
Mr. Chair, we had total vouchers of $1,051,643.81 on a report dated October 24th, 2018. Major parts of the vouchers include payroll of $333,000, Public Works $80,000, a state grant of $130,000, and solid waste of $60,000. I've reviewed the vouchers. I have no additional questions or issues, and I'll move to approve.
I'll second. So motion to approve by Commissioner Archer, second by Commissioner Cook. All in favor, say aye. All opposed, passes 3-0. Our next item.
There are no correction orders.
Okay, our next item.
Item A3, consider approval of resolution number 2018-54, authorizing a 2019 cereal malt beverage license to John's Food Center located at 5812 South Topeka Boulevard. And it is that time of year.
Yes.
You will be getting a lot of these. Well, not a lot, but it was just plain.
So
this is the first one. It's met all of the criteria.
Right.
We have as it says in the memo, that the counselor's office has reviewed it. We got a report from the KBI. The township has been notified. There are no taxes owing on the property, and the health inspection had been performed. So just asking that you approve the resolution.
I would move for approval.
Second.
Motion for approval made by Commissioner Cook, second by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item B, Kansas Expo Center, number 1, consider approval of request for payment of final year of a lease agreement with White Star in an amount of $6,800 for lease of 2 skid loaders.
Good morning, Commissioners. Kellen Seitz, Inspector of Venue Management, Kansas Expo Center. This is the 3rd and final year of our skid steer or skid loader lease with White Star Equipment. We ask your approval to go ahead and finish out this year, and then we will be seeking additional opportunities on how we retain our equipment in the future.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item B2, consider approval of request to award the bid for a point-of-sale system to Bypass Mobile and authorization to allow Spectra to negotiate a contract using funds identified in the Kansas Expo Center renovation budget.
Good morning, Commissioners. Kellen Seitz, Inspector of Venue Management, Kansas Expo Center. This project is one that was identified in our renovation budget. The point-of-sale system that is currently being used is about 6 years old. The equipment we are finding hard to replace and find replacement parts for. And we need a system that will allow us to operate a little bit more efficiently in our food and beverage sales side. The recommendation for Bypass is not only from Spectra, but also from Heart of America Food Services. They sat in on presentations from the companies, and we've moved forward with Bypass being the most efficient and responsive system for our campus. This system would not only encompass all of the point-of-sale system infrastructure for what we currently have, but will also encompass all of the new build-out areas and concession point-of-sale areas in the renovation project. So happy to answer any questions you have at this time.
This was part of an RFP process.
It is, yeah.
And we had 2 bids on it.
So we had a RFP, we sent it out to 3 providers. One provider did not respond. After doing walkthroughs with Heart of America Food Services, it was the understanding that that system would not work, and all the functionality and implementation of their system would not really work with our food service providing. So 2 responded, NCR and Bypass, and again, our recommendation would be Bypass for that.
And is this a facility, something you've been working with in other facilities and a provider that you have in other facilities?
Yep. Yeah, so Spectra uses Bypass in a number of facilities. I personally have used it in my last facility where I was general manager. It's a very easy system to use. It's quick. It allows us for increased efficiency for making sure patrons are getting their food service items in a timely manner and getting them out on an ease of transaction process. So part of what we want to do with this system is reduce wait times for customers. This system allows us to do that. It's very quick and simple for the operator of the system. The system can be converted and items on the sellable platform can be customized to what those stands are selling. So essentially you don't have to have a menu item for everything that you sell in the building. If you're only at a portable selling beer and water, you would only have beer and water, which allows you to kind of process those transactions on a much quicker pace.
Okay. Any questions, Commissioner Archer?
Move to approve the request.
Motion to approve the request by Commissioner Archer, second by Commissioner Cook. All in favor say aye. All opposed? Passes 3-0. Thank you, Kelly.
Thank you.
Our next item.
Item C, Public Works Solid Waste. Number 1, consider approval of request to acquire an iPhone for the incoming Director of Public Works Solid Waste with no cost for the phone and $50 per month for service with funding from the operating budget.
Good morning, Commissioners. Tom Flanagan, Public Works. We've coordinated with IT on this. As Ms. Beck says, it's for the new Public Works Director. I've got Mark Price here to help me if you have any questions on the iPhone. I don't have an iPhone. I have a flip phone.
One of the newer models, I assume.
I think so.
Well, if it still works.
It
keep
does.
using it. All right.
Move to approve.
Motion to approve by Commissioner Archer, second by Commissioner Cook. All in favor say aye. All opposed? Passes 3-0. Our next item.
Item C2, consider approval of request to solicit bids for various materials and products to be used for road maintenance and ice snow removal purposes during the 2019 calendar year and the 2019-2020 winter season, and authorization to waive bidding procedures for the following. A, purchase emulsified asphalt for tack oil from Bettis Asphalt at $50,000. B, crushed stone at quarry prices at quarries nearest to the location needed at $90,000. C, sign sheeting materials, state contract KTA prices from 3M at $25,000. D, sign blanks based on phone bids at $20,000. And E, signpost brackets based on phone bids at $10,000. Funding will be from the 2019 Public Works Road and Bridge Maintenance Funds, the Special Bridge Fund, and the Monmouth and Grove Township Roadway Funds.
Good morning, Commissioners. Tom Flanagan again. This is our blanket request for materials that we need to be able to operate in calendar year 2019 for road maintenance. I'd be happy to answer any questions you might have.
Tom, on Monday we had an issue that came up. There was not a specific contract provision regarding if we needed the hot mix asphalt, and under certain circumstances we would have the ability to have priority in making sure we meet those demands. Is the current contract going to have that language?
Yes, sir, it will. In fact, I just finished updating that contract, and we're cleaning up several of these contracts, so we have a better handle on getting our materials, and if those particular suppliers are not capable of getting us the materials we need, we can slide to the second one,
Okay.
as long as we stay within the budget.
Any questions, Commissioner Archer?
I would just point out that Betty Griner had reviewed this
Yes, sir.
process. I think that's important that we have the finance director sign off on this. And I'll move to approve.
Motion to approve by Commissioner Archer, second by Commissioner Cook. All in favor, say aye. All opposed? Passes 3-0.
Thank
2-0.
you, Commissioner.
Sorry, I've been saying that all morning, I'm short.
That's okay. We got you covered.
All right,
Okay.
thank you. Our next item.
Item D, Parks and Recreation. Number 1, consider authorization and execution of contract C 341-2018 with Cartograph Systems LLC for the annual maintenance of software used in the Cartograph OMS system at a cost of $244,697.06 to be divided between Parks and Recreation, Weed Department, Public Works, and Solid Waste for a term expiring November 30th, 2020.
Good morning, Commissioners. Josh Lehman, Parks and Recreation. The item you have before you is a renewal of our contract with Cartograph to continue use of the OMS system. As we looked at renewing that, we also looked at ways we could benefit the taxpayers by possibly expanding services, saving funds on that. What we came up with was to bring on board the Noxious Weed Department, Public Works Department, and Solid Waste Department to help defray that cost while also giving the benefit to other departments within the county. With that, I'll be glad to answer any questions you may have.
Commissioner Archer, any questions?
No.
Okay. I'll move for approval.
I'll second.
Motion for approval by Commissioner Cook, second by Commissioner Archer. All in favor say aye. All opposed? Passes 2-0.
Thank you very much.
Our next item.
Item E, corrections. Number 1, consider authorization and execution of contract C-342-2018 with Securious Technologies, Inc. to provide inmate video visitation services, appending to the agreement for inmate telephone services through August 27, 2024, maintaining the same commission rates that make all of the services zero cost to the county.
Good morning, Commissioners. Tim Phelps, Shawnee County Department of Corrections. I've been on a mission for the last 18 months or so, trying to wrestle with the perpetual issue we have with staffing to try to, if I can't have the staff, I have to decrease the need by services. And so I've been trying to compress how much manpower it takes to handle certain things with the inmates, including inmate grievances, telephone use, video visitation, commissary ordering, law library, and things like that that we have to constantly move an inmate from this place to another. I worked with Securus when I was in Texas at a program in April. I met with the director of product development and negotiated with them to leap over the little bites that the technology in this arena has been taking about solving these issues and get to as many of these services as literally possible to come down to one item that stays in the inmate's hands when they need it, and that's a tablet. So this contract is to bring those services all into the jail to the inmates on a tablet. They can make phone calls, they can do video visits wireless, and they can do all these other services from their cell, which reduces the necessary manpower and therefore the costs that are related to these items. So that's what this is about, and I'd be happy to answer any questions you have.
Tim, when we first started going to the video visitation, one of the advantages was that you would be able to have a visit anywhere in the world. You did not necessarily have to come to the Department of Corrections, which was a limitation previously. So that opened up the ability to have more frequent visits than you would otherwise. And but we did still allow an offering that if you were indigent or it was financially limited, you could come down to the Department of Corrections and have a video visitation for free. Do we still maintain that ability?
We do, and in fact, we're going to significantly expand it because we were still hamstrung to only having 2 visitation kiosks in each module. So we could only have as many visits available as we could use those kiosks. This would allow more inmates to be visiting at the same time, both local and remote, which will significantly expand that ability to stay in contact with friends and family.
I know that a constant criticism of Securus and other phone services are the charges that are used or how much it costs to make a phone call or video conference. And again, I think it's important to stress that they are free to the public if you are coming down to the facility.
The visits are free if you come down to the facility, and the telephone costs are in full compliance with the latest FCC mandates.
Commissioner Archer, any questions?
Yeah, but this is a service that's paid out of the inmates fund. There's no charge to the taxpayers.
There's absolutely no charge to the taxpayers from any fund, and in fact, we get a commission off of the use of these services that the inmates pay for, or the friends and family pay for.
Okay. If a constituent said, you're really coddling people in the jail, now you're giving them tablets, what's next? How would you respond to that?
Well, I would say, first of all, that these are services. The purpose of this is to bring the services to an efficient focal point. It's not to give them a toy. And these things are strictly controlled. Everything that's on them is recorded and can be looked at and monitored. Furthermore, the officer in the module has a tablet that can control all of them, so if they're not behaving, they can just turn the tablet off, and that would make it inoperable. So we have strict controls over this, and none of it is about bringing entertainment to the inmates. It's about managing the services that we're required to provide.
Okay. I think it's important that the public knows that, and the fact that it is an efficiency tool for us to use and save taxpayer dollars. Is that how you see it, and you're confident that that's what we're doing?
Right. That's my full focus,
Okay.
is to drive toward more efficiency and try to become paperless with our various systems.
Okay. I'll move to approve the contract.
I'll second, but I also note that with our staffing issues at the Department of Corrections, we are constantly recruiting for staffing, and that with a lack of staffing, there are more lockdowns. The tablets will allow for visit stills to continue even when we are on a lockdown status. So that is meeting our clientele, the people that are residing at the Department of Corrections, to still be able to have contacts, and those are some noted cases about when they are not contacts with, they can result in lawsuits, and so we're addressing that proactively. That's good. So,
Correct.
Motion made by Commissioner Archer, second by Commissioner Cook. All in favor, say aye. All opposed, passes 2-0.
Thank you,
Next
Commissioners.
item.
Item E2, consider authorization and execution of contract C343-2018 with Foley Equipment Company for the inspection, maintenance, and required annual load testing for the 5 emergency generators at the adult and juvenile detention centers and the corrections annex at a cost of $13,406.33 annually, beginning August 2018 and terminating 36 months thereafter, with funding from the agency budget.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. These are just annual renewals of contracts we have with our various vendors when it comes to the load checking and services for our generators. They are required in case we do have a power outage. This stays in line with our accreditation, stays in line with our emergency management COOP plan, and is something that we have to have in the event we do have a power outage. We have had power outages, and that we have to still maintain services at the Department of Corrections. And these are annual renewals, and we are have the approved budget for these funds, for this contract. And it has been looked at through Jim's office as well.
Any questions? I'll move for approval.
Second.
Motion made by Commissioner Cook, second by Commissioner Archer. All in favor, say aye. All opposed, passes 2-0. Thank you.
Thank you very much.
Our next item.
Item F, Health Department, number 1, consider authorization and execution of contract C344-2018 with Custom Data Processing, CDP, and contract C345-2018, which is the Business Associate Agreement, for the purchase of Easy EMRX, electronic medical record software, at a cost of $81,725. Additional costs with the purchase of scanners from Innovio? Sure. Close enough. As a third-party vendor at a one-time cost of $1,800 and a monthly recurring cost of $35, contract at a later date. And the Kansas Health Information Network integration at a one-time cost of $3,000, contract at a later date, for a total amount of first-year costs of $86,945 with funding from the Health Department Special Initiative Reserve Funds.
Good morning, Commissioners. Linda Oakes from the Health Department. This is a big day for us. Over a year ago, we heard that there were 4 other counties looking at an electronic health record system and going together. And I think my comment, Edith can tell you for sure, is how do we crash that party? How can we get in on that? That just seemed like a win-win in all areas. And so we were able to get in on that deal. And so it's Wyandotte, Johnson, Riley, Douglas, and Shawnee County have all gone together to purchase this system. We asked in February for permission to go out for bids, and then we brought it back in the summer to negotiate the contract. So it's been a long time coming. We're still using paper charts, which I believe predates Tom Flanagan's flip phone. by quite a ways. So we are ready to go into the modern era and get on an electronic health record. I do want to thank several people, and I'm going to have Edith Gaines, our finance officer and administrative division manager, come up and go through the system just a little bit for you. But I especially want to thank Wyandotte County. They did all the negotiation. They got the basic contract. Lynn Wilson, who is the Performance and Innovation Director, what a great title. She is the one who did all that background work. And then Ryan Baumschen from with our own IT department was our IT guy, and he helped us make sure we were on track with that. Ashley Biegert did all the contract for our county. Each county has a separate contract, so she did all that negotiation. And then we had several staff members that were involved in the work. And so we've been talking about this for years and years, so we're very excited that we're at this point. We're ready to go. We will be implementing it at the same time we're doing accreditation. So if we look a little crazy, it's because we are. But I think we'll be able to get it all done. I'm sure we will, and have a great system to use, much better services for the community, and just the benefits of this collaboration. We have a built-in user group already. All these counties can work together when we have questions or issues. Those other counties have been on electronic health records, so they can help us since we're new to this. And of course the price, we got a huge savings in the price. So I'm going to have Edith come up and show you a little bit about the system, and then we'll be happy to answer questions.
Good morning, Edith Gaines, Finance Officer with the Health Department. I'm just going to give a short presentation about the new EHR system. So custom data processing is from Romeoville, Illinois, and they are a nationally recognized corporation that specializes only in public health. So they have been in existence since 1981, and they began with a home health system, and then they added environmental health, a clinical system, and then a WIC solution. And here in the state of Kansas, we do utilize their WIC EBT card software system, as well as the other states. Okay, and so the actual software that we would be using is called Easy EMRX, and that was developed in 2015. They currently serve 40 public health clients. I believe that our collaboration would make 45. And the Easy EMRX system is a cloud-based system, so this would alleviate the county of equipment and server maintenance costs as well. One of the strengths of CDP is that they themselves have 128 employees, and then their strategic partner, Easy EMRX, has 138 employees. And so when they presented their demonstration to us, they just presented themselves as a very mature company with a large enough staff to provide adequate customer service and technical assistance. So the Easy EMRX system is a certified system by the ONC-ACB. ONC is the Office of National Coordinator for Health Information Technology. This is an office within the Secretary of Health and Human Services. And the ACB is authorized certification body which conducts surveillance to determine if a complete EHR system continues to function as required by its certification. So another benefit of Easy EMRX is that it is easily customizable to fit any clinic. And the system is interoperability, which allows us to interface with other programs. The EasyMRX also offers a comprehensive practice management system. So this will allow us to check insurance eligibility in real time, which will in turn allow us to collect payments more timely. And we can also collect payments from within the system itself, and the system can process both checks and credit cards. Some of the highlight features of the system are that it does have a dashboard. It has an immunization registry integration. It has a patient portal. It has a provider task list. It has adaptive clinical workflow, and then it also has built-in inventory management for vaccines. So the Easy EMRX product will allow our providers to achieve better clinical outcomes. It will give us ease in locating patient records and instantly and accurately. It will also eliminate the need for large storage spaces and patient charts. It will improve the quality of care and our patient experience. It will give us the ability to document patient encounter information with ease and consistency. It will also let the providers distribute electronic prescriptions. It will integrate with state health information systems, such as the immunization registry and other hospitals and labs. Again, it has the patient portal, and if desired, it can support mobile devices. So being an accountant, what I personally liked about this system is that it looks similar to working with Microsoft Excel spreadsheets. So as you can see, it has this unique tab layout that makes it easy to capture and report data. And all of the fields that you can enter into the system, you can also run a report on those fields. Then the system also integrates with devices such as webcams and signature pads for patients that need to sign consents that improve the patient experience. And this is a picture of what the patient portal looks like. So the patient portal is designed to provide documentation to the patients in the form of lab results, progress notes, referrals, and more. And information can be exchanged securely between the providers and the patients. The patients can request refills or appointments through the portal. They can also complete questionnaires before they come in for their visits, which feed directly into Easy EMRX. The patients can also pay their bills through the portal, again, by check or by credit card. So again, with the 5 counties collaborating together, our first year costs will be $81,725. Beginning the second year, there would be recurring costs of $45,840. And this would be for 32 users within the health department. And then we will have to contract with a couple of third-party vendors, one of which is Inuvio. They provide scanners for medical cards and identification cards. That would be a one-time cost of $1,800 and then a monthly recurring cost of $35. And then there would also be integration with the Kansas Health Information Network. That would be a one-time cost of $3,000, and then there's no cost to use that system. So the entire full cost of the EHR would be $86,945. And as Linda said, we intend on using our special initiative reserve funds to pay those. So then we expect the first kickoff meeting to be scheduled in about a month from signing the contract. And then there would be on-site training for a couple of days for core key staff, and then a couple of days training for end users, and then 1 day training for Go Live. And then in conclusion, the staff are just extremely excited about the new EHR, as we believe the implementation of Easy EMRX will improve clinical decision-making, it will improve care coordination, and population health management. So that concludes my presentation, and I would be happy to answer any questions you have.
Edith, this might be a question for you or for Linda, but just to kind of add some clarification. At the beginning of the meeting, we had a presentation from Alice regarding Grace Med. When the county got out of the health business, as it relates to medical services, what are the health services that the county is still providing that would justify needing this equipment? So what clientele, who are we serving, what services are we providing that would justify this expenditure?
Mm-hmm. Well, we still provide immunizations. We do have the CD/STI clinic. We also have family health services where our maternal child health program resides. And so those are the main programs that would use the service. Also, our environmental health and our child care programs, we would be able to bill their invoices through the system as well.
So even though Grace Med is operating, we still have clientele that we're serving, and this would add efficiencies to our billing and to be able to recover costs more so than we have with paper filing, and then this would also enable us to go into the future to be more efficient.
Yes, it would.
Okay. Commissioner Archer, any questions?
Yeah, a couple if you don't mind. This sounds like it's a digital patient record and software to operate the agency also. Is that, am I getting that right?
It would operate the patient, it would do the patient chart and what do we call it? It's the practice management software. So it wouldn't be for the whole health department, but more for the billing and for the clinic itself.
Okay, but you could look at immunization data and other data that's important for us to manage the business.
Yes, we
and
could.
Linda's nodding her head yes, so I just
Yes.
that's correct. What's the process to convert to the new system?
So the demographic data, CDP will be able to electronically transfer from our current system into the Easy EMRX. There may be a little bit of data entry that we would need a staff person to enter.
But it is a pretty seamless conversion?
Yes.
We hope.
Yes.
We hope.
Yeah, from their references have said that they were very easy to work with, and it was a seamless conversion. Yes.
One final question, if I may. Did we work closely with IT? Were they involved in this process to help us? And I know we worked with the other counties, but what role did IT play in the selection of the software vendor?
So Ryan Baumschen was a part of the selection committee, so he attended every meeting that we went to with the 5 collaboration counties.
Okay.
I would add with Ryan, too, he had experience with EHS, which is what the Community Health Center used before they broke off and became Grace Med. So the other counties were pretty excited to have his expertise, too, because he's been down that road a couple times. I will add, we will need to renew KIPS another year, which is our billing system we're using right now, and it also connects with the immunization registry. So we will be using KIPS one more year as we transition. We'll have to renew it one more year, and then we'll be out of KIPS.
Okay.
So.
Okay. I just think it's important when we do any project like this that we look at our internal resources as we move forward. So I'm glad to hear that IT was involved.
Betty Griner also helped me several times. All these panic, what do I do now? So it was great to have them help us.
Very good. I'll move to approve the contracts.
Motion to approve by Commissioner Archer, second by Commissioner Cook. All in favor, say aye. All opposed, passes 2-0. Thank you very much.
Thank you.
Our next item.
Item G, Information Technology. Number 1, consider approval of request to purchase 1,090 annual licenses for the purpose of migrating the current on-premises Exchange 2007 email server to cloud-based Exchange Online at a cost of $79,015 with funding from the IT 2018 budget.
Morning, Commissioners. Mark Price, Information Technology. This item is actually a correction to an item that was approved on the 15th of October. When we placed the order, the quote we had was from September. Pricing changed by Microsoft in October 1st, of course. The total difference is $2,385, and that will put us into locked pricing with Microsoft for 3 years.
So this is just to make sure we have the right price reflected?
Yes.
Okay. I'll move to approve.
Second.
Motion to approve by Commissioner Cook, second by Commissioner Archer.
Thank you.
All in favor, say aye. All opposed, passes 2-0. Our next item.
Item G2, consider approval of request to purchase and install replacement batteries for 2 uninterruptible power supplies that support the V-Block virtual computing equipment from Alexander Open System using the State of Kansas contract at a cost of $10,758.20 with funding from the IT 2018 budget.
Good morning, Commissioners. Frank Mcgee, Information Technologies. We have a redundant virtual server environments, one in the courthouse and one in the North Annex. And to keep those running, we have uninterruptible power supplies, UPSs, that keep those, if anything happens, we have any power fluctuations that they convert over, just like batteries in a car. After a while, the batteries wear down and you have to replace them. It's been 5 years since we got that equipment. And so the maintenance provider, AOS, had recommended that we replace the batteries, and so that's what this was about.
Okay. Any questions?
Move to approve.
Motion to approve by Commissioner Archer, second by Commissioner Cook. All in favor, say aye. All opposed, passes 2-0. Our next item.
Item G3, consider authorization and execution of contract C346-2018, renewing contract C413-2013 with Alexander Open Systems for annual maintenance of 2 Liebert uninterruptible power supply units at a cost of $7,060.72 with funding from the IT 2018 budget.
Good morning, Commissioners. Frank Mcgee, Information Technologies. This is just our recurring maintenance agreement with AOS, who actually does the maintenance on our UPSs. They are a little bit different because one has a distribution cabinet and the other one doesn't. But other than that, there's two actual contracts, one for each machine.
Any questions? I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Archer. All in favor, say aye. All opposed, passes 2-0.
Thank you.
Our next item.
Item 5, Administrative Communications.
This is an opportunity for any department head or member of the public to address the commission.
Good morning, Commissioners. Kellen Seitz, Inspector of Venue Management in the Kansas Expo Center again. I wanted to give you an update. I teased it on Monday at the commission meeting, but on Tuesday we announced Disney on Ice, Frozen, featured after the movie Frozen. I will spare you my singing expertise on that one. That event will have 7 performances running April 25th through April the 28th. The pre-sale for that starts today. You can go online. If you're part of our email database club, you'll receive an email with a code to get pre-sale tickets. You can always go to the box office and get those pre-sale tickets as well. Public on sale for that goes on sale Tuesday next week, which would be October the 30th. So,
Right. Sounds great.
thank you.
Good morning, Commissioners. Linda Oaks from the Health Department. This Saturday is the first of our 2 free flu clinics for uninsured adults. So anyone that does not have insurance, I'm sorry, it's tonight. I hope I didn't say Saturday. Tonight from 5 to 7 p.m. at our 10th Street Clinic, which is at 2115 Southwest 10th. Again, Medicare and Medicaid, that's insured. So this is for people who have no insurance from 5 to 7, just adults 19 and over. And we recommend that everyone 6 months and older get a flu shot. And also, if you're sick, please stay home and wash your hands often and cover your cough. Thank you.
Thank you.
Good morning, Commissioners. Randy Luby, Parks and Recreation. Saturday is our trout stocking at Lake Shawnee out on the east boat ramp. We are stocking, again, 7,000 pounds of rainbow trout. Last year, they averaged about 2 pounds per fish. And a reminder, the lake would be closed starting Saturday until the following Saturday, November 3rd, which we open trout season up at 6 a.m. We're approaching a historical mark. Next year will be the 40th year of our trout program. When it started, the ex-commissioner Ted Inslee and Director Ted was instrumental in getting this started. We were one of the first fresh trout programs in the state at that time. So, and also I'd like to mention this is the second Saturday and last Saturday for Spookamotive, our Halloween program at Gage Park. We have the train rides. It's kind of a spooky little train ride that goes around Gage Park. We'll have our wreck and roll mobile unit out with some music and free giveaways for the crowd. So come on out and enjoy it.
That's good. Randy, in the past we've had events at the trout stocking for the kids to watch the trout being stocked. Are we doing that again? Or?
Yes, that's at noon on Saturday. Okay. They will be, and it is a great opportunity. Our staff usually catches the fish in the dip nets and lets the kids get close to them and really get to experience the trout.
All right.
All right. Thank you.
Cool. Any other administrative communications this morning? Commissioner Archer, anything to share?
No, I'm good. Thank you.
This weekend, I think that you take advantage of the weather. It's before it gets cold. Fall is upon us. Make all of your preparations now. If Dusty Nichols were here, and I'm sure he's watching, there's no time like now to start thinking about winter and preparations. So with that, our next item.
Item 6, executive session.
There is not a need for an executive session. We are adjourned.
I'll skip to you. Give me the original one.
Doing anything?
And
Doing
we
anything
will,
this weekend?
we don't need a second thing. I'll put 2 contract numbers on the,
How about yourself?
PCA